of things that people struggle with body confidence. Big one for cervical cancer is the piece of vulnerability, and the second one is their sexual health afterwards. Hi there, my name is Dr. Katrina Cox. I'm a naturopathic doctor and the author of The Opportunity in Cancer. Today on this video, I'd like to address cervical cancer and some of the frequently asked questions that I see in clinic. To do this in a conversational way, I've invited my friend, Dr. Quinn Hand, who's also a naturopathic doctor, to ask some questions and be a part of this conversation.
Thanks, Katrina. I'm so glad to be here to help sort of enlighten everybody about some of the various factors we want to think about with this very important cancer. It fits sort of into our gynecological cancers, but it has a bit of a different etiology or cause, making it a little bit different from things like ovarian and breast cancer. Can you tell us a little bit about that in the first instance?
Yeah, so cervical cancer is different in the fact that it's not the same. It generally isn't caused by hormones, right? And so other factors that influence other gynecological cancers, such as ovarian, uterine, or breast cancer, are generally very hormone-based factors. With cervical cancer, it's actually driven by viral replication. And so a lot of people will, know this because there are some tests and there are some, immunizations that people think will stop the cervical cancer. And the key, though, to this is that there are many, many different viruses that can be a part of this process. And there is a family of viruses that is large that can be a part of developing cervical cancer. And so because of that, there is a lot of changes that we can do and have a very different way of approaching recovery post-cervical cancer and rebuilding our life.
Mm-hmm. And so just to help out our listeners, again, I'm sure many people are versed in this, but the viral family that we're talking about is HPV, or human papillomavirus. And as you said, we do have some vaccines for this that address sort of the most common ones that have the most virulence, meaning they have the greatest potential to cause cancer or disease. But there's 118 different strains of this virus, so not all of them are actually going to be covered off. And some of those, while less problematic, can still cause cancer in the long run.
Absolutely.
So what we want to be able to do is really look at these other ways to improve the body's ability to fight this virus. So that kind of plays into the notion of preventative strategies and alternative monitoring strategies that we've been talking about over the course of our various videos this last little while. So can we talk a little bit about that from a cervical cancer perspective?
Yeah, so it's a very different focus. I mean, ultimately, some of the same, pieces apply, right? So we metabolically want to make sure that it's an inhospitable environment for replication once we get to this cancer space. But that inhospitable environment is a little bit different because it's about viral replication and cellular replication. Originally, what we really want to do to get to the foundation of this is make it so that those viruses aren't very easily replicatable and our immune system can connect with fighting those off. And so that shifts this a little bit. Yes, of course, we still want to keep our inflammation under control. CRPs and ESRs, like I've talked about before, can be a very big part of that in keeping those numbers down. But more importantly, with cervical cancer, it's about those nutrient deficiencies. And so big ones are vitamin D, right? Especially because we live in a place, or a lot of us live in a place where vitamin D is not as easily to accessible. And so vitamin D is a big part of this because it's a part of replication. There are some other nutrients that are important, like vitamin A and vitamin E, but the blood tests that we have to determine their optimalness or their deficiency states are lacking in terms of their effectiveness and efficiency-ness for patients. And so there are some things that we can metabolically do. And so the big thing is about making sure that we're honing in on some of those cellular replication vitamins and minerals that are really, really important.
And so what are your sort of top nutrients that you like to look at in this realm in order to support that immune system to ensure that we're getting appropriate cellular replication as opposed to this aberrant replication that's being driven by the virus?
Yeah, so that's really crazy because it's a pretty big list, but it can be done from a nutritional perspective. It can be done from a supplemental perspective. And so the big ones for cervical cancer include vitamin A, like I said, vitamin E, vitamin C, folate, so not folate folic acid, but folate are the big four that I work with patients on. And a lot of the cellular replication or proper cellular replication, they can come from nutritional sources. Sometimes with patients, we'll also intervene by adding because they're fairly inexpensive supplements. But folate, for example, having leafy greens every day is a huge proponent of developing those appropriate folate pieces. Now, folate is a special one because there's also something called folic acid in our diet and in our environment, and that one is actually the one that we want to avoid. We want to stick with those folates and not the folic acid. And they tend to be better for cellular replication, whereas folic acid can actually interfere with the proper cellular replication and really reduce our chances of getting that proper space and that we're looking for in the terrain.
So I think one of the key things to help our listeners with is that differentiation of folic acid being a synthetic form of the nutrient versus folate being that naturally occurring form. And we can still do that supplementally, right?
Absolutely. So there are supplements, so the first one I tell patients is they'll come in and say, oh, I'm taking a B vitamin. I'm like, great. I need to know brand and I need to know kind, or where you got it from or whatever, because I can look it up on the internet and I can tell you if it's in its active form or not. And that's really important because a lot of them will use the cheap nutrients and put folic acid in it instead of using the active versions like the folates. And so there are supplemental ways that you can do that, reduce your risk of exposure. And then there are food ways, right? And so enriched flours tend to be a place where we get a lot of folic acid. And so those become cereals and they become, breads and pastas and things like that. And so watching our synthetic folic acid intake and making sure we're getting more leafy greens and some of those other pieces where those naturally derived folates are is a great way to balance that and to understand a little bit more about the nutrients that you're putting into your body in terms of creating that terrain that doesn't allow for that viral replication or that tumor growth.
Yeah, exactly. And I think that also ties into some of our concepts around maintenance therapy. So again, we have conventional maintenance therapies, and then we have things that we can be doing within the natural realm, many of which do surround those nutritional components we just spoke about. But let's talk a little bit about sort of the conventional maintenance therapies and how those ultimately play with our natural options as well.
Yeah, so maintenance therapy with cervical cancer tends to just be follow-up visits, right? There's not really a lot of, because it's the viral replication and not a tumor marker, they don't tend to follow blood work, for example. There aren't really maintenance therapies other than, visualizations and making sure that there isn't more cellular growth. There aren't really things that they do in terms of, following up for maintenance either. But naturopathically, focusing on creating that supportive environment, making sure we have the vitamin A, the vitamin C, the vitamin E, a well-balanced nutritional diet that isn't heavy in folic acid and is helpful in that folate can really help go alongside that. There are some other things now. So this is a specialized cancer because it's in a special space. And so we have talked a little bit about the effect on the vaginal area. And in cervical cancer, this is no different. The vaginal area itself can be very much impacted because of where they do the radiation or where the surgery occurs and the scar tissue that gets developed in that state.
Mm-hmm. And so some of the ways that we want to try and address that side of things in terms of the vaginal health and the sort of outcome challenges that people face, what are some of the strategies that we might look towards in order to help individuals with a vagina feel more comfortable and have less side effects after their treatment?
Yeah, so conventionally, a lot of patients will be handed dilators, okay? So there are apparatuses that are meant to make sure that the vaginal canal doesn't grow in on itself or close so tightly that that you can't be visualizing the area, or the vaginal canal itself doesn't collapse on itself. They can come in various shapes and sizes. One of the things that I find with my patients in the cervical cancer realm is that they're handed one and told to use it, but not necessarily given the proper education on how, when, how often, and those types of things. And so this is where I say we need to partner with a very educated pelvic floor physiotherapist, because knowing when and where and how large and what size to use in terms of a dilator and how often to use it and whether it's working or functioning is really, really important. And that's where somebody who is very specifically educated and can help with that pelvic floor, connection is really, really important. The second piece piece to the work with dilators, and the challenge can be that sometimes the scar tissue that's come from the surgery and the radiation already aggravates the space of vaginal dryness. And depending on where you're at in your hormonal world, right, vaginal dryness could already be something that you struggle with. And so finding the right lubrication to create that space so that the dilator doesn't hurt or rip or tear is really important, and understanding that there is a lot of vulnerability that's created because of having cancer in that space. And so sometimes that creates that psychological component to close things up or hold our pelvic floor really tight. And so this is, again, where working with a pelvic floor physiotherapist and finding the right lubrication while working with a dilator or with exercises could be very, very helpful.
Mm-hmm. And are there things within the naturopathic world, aside from, obviously, yes, we're recommending perhaps natural options for lubrication, but things like acupuncture and other elements that can help with that sort of physical lower pelvic region that
Absolutely.
you find are really beneficial for patients?
Yeah, so there's naturopathically, there are some things that we can do alongside all of that. Acupuncture, like you said, is number one, okay? It can really help to realign the nervous system. It can, and a lot of people go, well, how does it work? First of all, it works by addressing the nervous system's function. Remember that every muscle in your body has to get a signal from a nerve. And so if we can relax those nerves, especially if things are very tight or they've been very damaged through the treatment, we can actually have a big impact. There are other things that we can do with acupuncture as well, in terms of making sure scar tissue is broken down, right? And getting into where those places are being affected by scar tissue. So there's the physical, local type things that we can do, and then there's the entire whole body things that we can do from acupuncture. There are some studies about laser therapies as well, using red lasers to help with breaking down scar tissue and inflammation in that area. They tend to be hit or miss. When they work for people, they work great, and when they don't, right? And so that's just a kind of a trial and error situation, essentially, that we can use alongside that pelvic floor education, and the dilators and the lubrications and things like that.
Mm-hmm. And I think the pelvic floor physiotherapy and some of our physical therapies that we were just talking about in terms of acupuncture, laser, etc., those play into body confidence and helping rebuild that, because that can be quite shattered through the cancer process in general, but definitely when something like the vaginal canal and the associated areas like the cervix are impacted for individuals.
Absolutely. And so body confidence in cervical recovery is the fact that the two pieces. The first piece is that because this is a different type of cancer and it's on viral replication, there can be stigmas about developing cervical cancers. And those stigmas can be because people just assume that you were dirty or that you got this virus because of, and all these other things. And so that assumption and stigma is a really big challenge in terms of recovering our body confidence, because these things are not straight lines, right? It's not a straight line, to be able to throw or cast shadows or judgment based on a lifestyle that you lived in order to be able to be exposed to HPV. So that's the first piece to this. The second piece with body confidence is sexual health. A lot of women will find that their, cervical cancers tend to start younger. So they're in their 20s, 30s, and 40s, and they have a lot of sexual life left, but they've been impacted because it is one of the most challenging cancers, in the sense that people are all up in your business, right, on a fairly regular basis. You're having to do a lot of exams and pelvic exams where people are looking around down there, and that can really shatter someone's confidence in terms of being able to feel sexy or being able to intimately connect with a partner. And there's a lot of sexual life left in a woman in their 20s, 30s, 40s, and so on, 50s. And so ultimately, that body confidence piece comes down to those things that we just talked about, physically the changes, needing dilators, needing vaginal lubricants, all that stuff, being able to achieve orgasm, feeling sexy, and also not feeling, as a piece of meat, if you will, or as, yet another people that are down there kind of thing, so that they've taken the fun or the connection or the intimacy out of what that all represents. And so there are a lot of things that people struggle with body confidence. Big one for cervical cancer is the piece of vulnerability, and the second one is their sexual health afterwards.
Mm-hmm. And so I think if we were to sort of sum this up for our cervical cancer survivors to thrivers, what are 3 top tips that you would give them based on these frequently asked questions that we've covered today?
The first one is make sure you get an assessment done. Pelvic floor dysfunction is relevant. It's important. So get an assessment done at some point in this recovery process. The second one is understand what your limitations are and what the things are that you really need, right? So looking at nutrition, looking at nutritional strategies, making sure that you're putting together a strategy and a plan that works for you, that makes the most sense. And then the third one is making sure that you're talking to someone about the emotional components of those body confidence pieces that we were just talking about, because there is a big emotional component as well as the physical components that are associated with those. And so those would be my top 3 tips.
Amazing. Thank you, Dr. Katrina, and thank you to all of our listeners. We'll be back again with more information about our variety of cancers to help empower you and feel more confident in your cancer thriver journey.